Evers from Student Health and Wellbeing. With me today is Nancy Rivera, a nurse practitioner from the Student Health Center. Nancy is here to talk about sexually transmitted infection testing, or STI testing. Nancy, thanks for being here today.
Thanks for having me.
So could you talk about what STI tests are offered at the Student Health Center?
Sure. So at the Student Health Center, we have the capability to test for all STIs, including chlamydia, gonorrhea, HIV, syphilis, herpes. We do actually offer one student health fee covered test per year for chlamydia and gonorrhea per academic year. And any subsequent tests thereafter, we offer a discounted rate of $50. So just something that is important to know.
So what are the screening guidelines for the different STIs?
All right, so for screening guidelines, I'll just kind of go through the common sexually transmitted infections. We'll start with chlamydia and gonorrhea. For those infections specifically, it's very important for most populations to have annual screening because we can often see asymptomatic infections, which can, left untreated, lead to other complications such as infertility, HIV, cervical cancer. So it's population specific. Women who are sexually active and under the age of 25, it's recommended to have annual chlamydia and gonorrhea screening. For women over the age 25, we do still encourage annual testing, but CDC guidelines recommend it more strongly in those that are at a higher risk, which would include more than one sex partner or sex partner who has also concurrent partners. In men, annual screening is not necessarily recommended unless it's a high prevalence clinical setting, which college population could be considered at a higher risk. So we do recommend men coming in and getting that annual screening done. For men who have sex with men, it's recommended at least annually to have a chlamydia gonorrhea screen, and more frequently if they fall in the high risk category. As I mentioned with women, it would be the same, more than one sex partner and that kind of thing. And then we'll move on to HIV testing. For most of the population, one-time testing is reasonable. Annual or more frequent testing based on your risk factors. Now with the MSM, or men who have sex with men population, it is recommended at least annual for that population. And anytime who a patient or student has a sex partner who he does not know their HIV status, or there's been new partners with that. Next would be syphilis. For the general population, actually screening's not recommended. However, in MSM population, at least annually, once again, for that. We do get frequent questions about screening for herpes. I'd like to mention that there's really no good screening test for that or any kind of recommendation for screening. That we do offer testing, which is based on symptom specific concerns. So just a lot of questions in that area. Any other one would be genital warts or HPV. Once again, for general population, not a screening test for that. For women age 21 and older, we do cervical cancer screening or pap smears. And if there's any abnormal results, HPV testing would be indicated in that particular setting.